I'm Dr. Craig Escude. Welcome to Medical Monday. We're continuing our talks on behaviors indicating underlying medical conditions. Now, if you see someone who becomes agitated, nervous appearing, sweaty, jittery, just maybe breathing fast, one of the first things you might think about is the person is having an anxiety attack or a panic attack. And that certainly was the case in this gentleman that I'll call Fred a few years back. He was having these episodes, and people kept on saying, Fred's anxious. Fred's anxious. He's nervous. He's just gets upset. He starts pacing around. He kind of, gets anxious. He gets all worked up. And then after a while, it kind of settles down. And then these things got more frequent. He seemed to be in real discomfort. And people, started to say, you know what, something worse might be happening. Let's get a look at this. And finally, one of the nurses was there and saw this activity, this behavior that this person was having. And she looked at him and said, you know what, this really looks like it could be chest pain. And this episode got a lot worse. He became very short of breath, started looking very pale. They sent him to the emergency room. And sure enough, Fred was having a heart attack. Really, really important to think about anxiety type appearances or appearances of anxiety, things that we think are anxious type behavior, that it actually could be angina, which is chest pain related to not enough blood flow in the heart. So we typically will see these things more around times where a person is exerting themselves. It's not always that case. You're going to see that less in someone who's younger, of course, but you've got to think about it. And if you see anxiousness, sweatiness, having trouble breathing, especially, of course, if you see something like somebody's turning pale or blue or not breathing well, that really needs to be evaluated, and it could be a medical emergency. So make sure your nurse, your healthcare provider knows about these types of things, because what we think might be a panic attack could actually be a heart attack. Thanks for joining me today. See you again soon.